and start broadcast.
The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to the Introduction to Logic Models for the CBA webinar session. Thanks for registering, and hopefully you will find the next hour and a half informative and supportive in your role of supporting our place areas develop a robust operational plan that will obviously include CBA. I'm Jim Asprey, and obviously I've had the pleasure of meeting with most of you now at the various events. And as you know, I'm the Our Place Program Manager. My role today is quite simple. It's really just to introduce you to the session and manage the question and answer sessions, of which we have 3 throughout. The main presenter today is David Morris from New Economy Manchester, who are one of the Our Place Programme Delivery Associates. David is one of our experts on all things CBA and logic models, and some of you may have met him at the recent round of CBA events in Bristol, York and Birmingham. I'll shortly be handing over to David to start the session. Firstly, I thought I'd spend a couple of minutes putting this session into context and highlighting why completion of the Our Place logic model has been identified as a key requirement for all areas. As you know, we are at a transitional phase of the Our Place programme as we progress from getting ready to getting going. We are nearing the end of the process, and to date we've assessed 120 plus of the 141 areas, applications and development strategies, and have confirmed with the majority of areas that they've been successfully progressed to year 2. And from that, you as relationship managers will have received some contracts and calls from Kobe, my colleague, just linking you and matching you with areas. Having sat in 18 grant panels to date, it's obvious that CBA has been identified by nearly all areas as a key element of their operational plans. Many have costed in CBA into the 10,000 budget for getting going, in addition to highlighting CBA as the main focus for their 5 days consultancy support. All of this is fantastic. However, is it necessary? As program manager, I want to ensure that all operational plans are robust and fit for purpose, and this includes having CBA that is appropriate and proportional. It may be that areas are proposing is particularly complex proposal and may warrant detailed CBA. However, many other areas may be proposing something a lot more simple that requires minimal CBA. So appropriate and proportional are the key words, and to support areas develop CBA that is proportional, they've all been requested to, in the first instance, complete a logic model for September the 1st. This will be reviewed by an expert panel. All logic models will be categorized 1, 2 and 3, 1 being simple, 3 being complex, and the level of CBA required fed back to each area by the middle of September. To support this process, we are running logic model webinar sessions for all areas. We had 30 areas dial in last week, and we have another 40 participants dialing in on Friday, and the intention of this process is to make sure we can provide a steer towards the level of CBA that will be proportionate to them, and the hope is that we will potentially save them time and resource going forward, because many areas at the moment, as I say, have put lots of resource and time towards CBA, and there's a possibility that mightn't be required. And they can actually focus some more of their direct support and relationship management support in other areas. I'll talk more about the process and the timeline later on in the session. In your role as relationship managers, having an understanding of the logic model, its purpose and why we've introduced it into the process will provide you with hopefully the confidence and capability to help you advise and guide areas with respect to any questions on logic model, and that really is the purpose of today's session. We're not expecting you to complete the logic model on behalf of the area. That is the area's responsibility, but we do hope that you're in a position, as I say, to advise and guide during that process. I did mention that the date was the 1st of September, so areas only have 6 weeks to do that, but it is only really an afternoon's work that they need to do with their partners, but I'll discuss that more later. Just to let you know, throughout the session at regular intervals there will be opportunities for questions and answers, and indeed we'll initiate a couple of polls which are questions to you. To ask any questions, there is a section on the right hand side of the control panel where you can type your question. And I should add, if there aren't any questions, or there are any questions that we can't answer in this session, we will get back to you at the earliest opportunity. There is also guidance to support this session that is available on the rplace website. Okay, I think that summarises everything. So hopefully you've got a good feel what the purpose of the session is, and you know your role in the logic model going forward. So without any further introduction, I will hand over to David. So thank you.
Thanks, Jim, and good morning, everybody. Thank you very much for logging into this morning's webinar. As Jim said, I think I've met some of you at the 3 events so far, so hello again to you guys, and for those I haven't met yet, I'm sure our paths will cross at some point over the next few months. The structure of today's webinar, we're going to start by looking and trying to answer the question, what exactly is a logic model? So for those of you who haven't come across the concept or the illustration before, just telling you what one is. Then the meat of the webinar will be around, okay, how will areas produce their logic model? I'll be using the example of Poplar Neighbourhood Community Budget, which was one of the 12 pilots that started a year before the main group of rplace areas. So I'll be walking you through the stages of a logic model with reference to their work. And then at the end of the webinar, there are some tips and tricks that you can refer to when you're advising and supporting areas to complete their logic model, and also my thoughts on how a good logic model can really make cost-benefit analysis easier. So if some of the areas you are supporting are told that they need to undertake more detailed cost-benefit analysis, they can have confidence that that's not going to be too difficult a task because they've got a good logic model in place. As Jim mentioned, there's a chance to ask questions at 3 points throughout the webinar, so please submit those questions to him as they arise. I should say that there's written guidance to accompany this session. I've written that guidance so you can either read it alongside the slides will also be posted online, but also for areas and relationship managers who haven't been able to log into one of the 3 sessions, there's a chance to read through that and understand what a logic model is. Just to start us off, Jim mentioned there are also some polls. We've included a poll up front which is about gauging your current level of understanding of logic models. So Jim's just about to launch that question, but you should see on the screen in front of you my PowerPoint question. So it's, what experience do you have of working with supporting completion of logic models? So if you could start voting, you should have a vote box on the right-hand side. So yeah, half of you have voted, 2/3 of you have voted, nearly all of you have voted. Just wait for a few more of you, just a few more to vote. There we go, we've all voted. So I will close that poll down and we can have a look at the results, and I'll just share those with you. So they should be coming on your screen now. So what we can see there then, so so some of you don't know what a logic model is, so hopefully the next few minutes should be useful for you. Looks like about half of you have some experience of undertaking a logic model. So hopefully today although the logic model I illustrate and walk through might look slightly different from what you've experienced before, you should see the commonalities. And for the 45% of you who have no experience, again, hopefully the walkthrough example should give you confidence. As I say, at the end, we'll return with another poll question, and hopefully we can see how many of the 50% of you with less experience are now confident to begin. So I will just hide those results, and we should come back to my screen. There we go. Right, so as a starting point then, on your screen in front of you, you should have the logic model that we're going to be using for the ArcSpace program. There are lots of different ways of illustrating a logic model. Some of them, such as this one, are circular. Others are set out in linear fashion across the page or down the page. But essentially they all have three fundamental steps. Firstly, up in the top left-hand box entitled Conditions, a logic model sets out what is wrong. So what are the issues within an area, within a locality, that need to be changed. In the bottom left-hand box, so in my version entitled Program Objectives, that's where you set out what needs to be done to correct what is wrong. So you describe a program or a process or a series of projects that are going to challenge things. Then on the right-hand side, you have two boxes. Jim, are you still on the line? Sorry, we've got a bit of noise from one of the other presenters. If you can't hear, just flag that, stick your hand up, but hopefully that should go away. So on the right-hand side, the third stage of the logic model diagram is saying, well, if we do the correct thing to challenge what is wrong, what will be the desired outcomes? So what changes will we see within the area, within society, which will mean that the initial problem we identified has gone away, as it were. So if you think about that logic then, from what is wrong, what are we going to do about that, what will be the outcome of what we've done, what we're really describing is a virtuous circle. So if a project proceeds as the logic model says it should, then you should remove those initial contextual factors and eventually remove the need for the intervention. So you're removing the need for public sector intervention. I'm going to just now talk you through each box in the logic model in a bit more detail, and then we'll move on to actually describing the detail using the Poplar example. So starting us off then in this top left-hand box, conditions. The first thing here is the local context. So what we mean by local context is what is the evidence of the issues within the local area that need to be changed. So examples might be data on local unemployment rates, it might be data on local rates of ill health. Often when you put statistics, that kind of context in here, you'll also put things around how that issue has been getting worse over time. So you might put trend data in. You might also put comparisons to other areas. So if you're supporting a district, for instance, you might say the issue within the district is X, within the wider county or region, the issue is far less prevalent. Here's the evidence for that, for instance. So in this box, you need to put evidence around the problem that the area is seeking to challenge. You also need to put some policy context. So what are the local and national policies that shape how we respond to those issues? So do local councils or CCGs in the health sphere, do they have policies that they're prioritising, issues that they're really focused on, whether that's around health and social care integration or youth unemployment, for instance? It may also be that there are relevant national policies. So welfare reform is obviously a big example of this. So expecting people to be more proactive in their search for work, for instance. The localism bill would be another example of a good national policy. So suggesting that communities should have a greater say over the design and delivery of services. So you need to list here the policies that you feel are relevant to the project. And then finally, underneath that, what needs to be in place for change to occur? So examples might be, do local residents and service providers need to adopt new attitudes towards the role of the public sector? So do we need to change attitudes from being one of the public service provides the support I need to I need to proactively identify which services can support me and tell them how they can do that, for instance? Is it about information changes? So at present, the way services are communicated and delivered is ad hoc and there's lots of duplication. Do we need to get to a more intelligent way of identifying people's problems and responding to those in a timely manner? So what needs to change for those issues you've identified, such as youth unemployment or high rates of ill health, to change? So that should give a casual reader of a logic model a quick understanding of this is the background that this rPlace project is working with and seeking to change. The bottom left-hand part of the logic chain diagram should give the casual reader the nuts and bolts of what the rPlace areas you're supporting are seeking to do. So they should be able to read these 5 boxes and have a good initial understanding of, okay, that's the money that's going to be spent, the resources that are going to be used, the activities that are going to be delivered, etc., etc. To talk you through the boxes here, high-level objectives, so program objectives. These are things that you commonly see written down in a business plan. So they're usually sort of 4 or 5 bullet points, and they really distill the more detailed outcomes that a program is hoping to achieve. So they'll talk about objectives in terms of outcomes for individuals or residents. They might also talk about objectives for the organisations that are taking part. So streamline joint working between us, duplication of best practice approaches between organisations, for instance. But there'll really just be a high-level distillation of the outcomes that are being targeted. In the bottom left-hand part of this large box is the box entitled Rationale. This is something that sometimes confuses people. You know, what do you mean by rationale? But basically, in this box, you need to answer the question: why has the rPlace team designed the delivery of their program as they have? To put it in another way, why will the problem not go away of its own accord? So why do you need extra activity, a reprofiling or a refocusing of resources? Why can't public services they're currently configured solve the problem? Or why can't individuals on their own solve their problem? So an example of ill health, it might be something around, you know, at present because of budget cuts, there isn't the extra resource to focus on this particularly at-need cohort. Or it might be something around people with ill health limits their mobility, so therefore they're unable to get out and access the services that are currently available to them. Hence, we need to redesign towards the more community home-based healthcare system. So that will be an example of the rationale question and how you might answer it. I should say that alongside the written guidance, I'll be sharing various glossaries of terms around evaluation and logic models, for instance. So your areas can refer back to that if they forget what a specific term means within the logic chain. Next to rationale, so inputs, this box is usually quite easy to fill in. In it you should list all the funds, the staff, the equipment, the facilities that are available to the rPlace program that you're supporting. So by funds obviously we mean cash and budgets. You'll put in some numbers of staff, ideally in FTEs, that means full-time equivalents, so part-time and full-time staff. You'd also put in capital equipment, so are there IT equipment, are there community facilities being offered, so a room or a venue to host the activity, to make the activity known amongst the community. Also in this box, don't forget that your rPlace areas should list all the support, the inputs that they're being given in kind. By that I mean all the inputs that they're being given without having to pay for them. So if there's a large volunteer base supporting the rPlace area, that should be acknowledged in this box. if community facilities or equipment are being given free of charge, that needs to be included in this box. The reason for that is that those inputs could be used to deliver other programs and projects around the area. There's an opportunity cost, as we call it, to them being used for the rPlace program, and that needs to be acknowledged. So that should be your inputs box. And then the activities box flows nicely from that, so that's saying, what will the partnership do with those inputs? So what are the day-to-day activities of the rPlace program? So these might be running community events, it might be arranging training days, it might be providing advice and guidance leaflets, it might be about setting up a website so people can influence the shape and delivery of local services within their community. So the daily activities of the rPlace program over the next few years should be set out here. In terms of outputs, so this is simply the measurable or quantifiable number of activities. So to go back to those examples I just gave, if your activities are running community events, then in the outputs box you'd say 5 community events or 10 community events. If your activities are going to be the delivery of training days, then in the outputs box it might be 100 places on a training course purchased or brokered or however it's set up. So it's the immediate, measurable, quantifiable results of those activities. That then should give the reader a good understanding of this is what that Places rPlace program is about, this is why it's needed, this is how much money and staffing and equipment is going to be used to deliver these activities, and in terms of the numbers of those activities, these are the numbers that they're going to be delivering over however many years it is. These are the targets, the performance indicators, if you will, they're sometimes called, that we can measure that program against on a daily basis. Moving on then to the final 2 boxes in the logic model, so intended outcomes and intended impacts. If you remember, I said at the start that this part of the logic model is where you move on from saying, this is what we're going to do, and you start to answer the question, and if we do that successfully, these are the effects we should see within our local community, within the wider economy and society. So in the intended outcomes box, what you're saying here is, if the rPlace proposal is a success, then what are the medium-term or wider consequences within the lives of residents or clients as a result of the activities and outcomes? Examples of outcomes, so there'd be things like improvements in residents' long-term health, it would be young people entering sustained employment. So to just try and illustrate the difference between an output and an outcome, let's take that latter example of young people entering sustained employment. If you had an rPlace program that was focused on tackling youth unemployment, let's say your outputs might be to broker 50 apprenticeships within local businesses. So that's your headline target. We're going to get 50 apprenticeships within local businesses. So your intended outcomes from that might be something like 40 young people entering sustained employment. So you're not interested in the measure of, did those 50 apprenticeships get taken up per se. What you're interested in this outcomes box is, and how many of those young people then sustained employment. So what was the medium-term consequence in their life as a result of the rPlace program brokering those 50 outputs, those 50 apprenticeships? So it's moving on to the medium to wider consequences of those activities. Other examples of outcomes, more people volunteering, more people saying they have a greater say in local service delivery. That just leaves then the intended impacts. So if you think back to the start of a logic model and that conditions box up here in the top left-hand corner, up here we're going to be putting data and evidence, this local context, around what is wrong within an area. So is it that they have a high youth unemployment rate? Is it that they have high rates of ill health around things like cardiovascular disease, or low rates of daily activity, or poor diet, for instance? So in the intended impacts box, we need to say, what positive impact is rPlace going to have upon those wider contextual factors? So to go back to that example, for instance, of young people and apprenticeships. So if the rPlace program is looking to generate 50 apprenticeships or 50 outputs with local businesses, then we said, let's say 40 young people then get sustained employment. So that's our outcome, 40 young people in sustained employment. Then what we put in the impact box would be a reduction in the local youth unemployment rate. So the rPlace program, by getting those 40 young people into sustained employment, will have had some impact on local youth unemployment rates. But it won't have been the sole influence of that. There'll be wider things going on in the economy which will affect the youth unemployment rate. So we've gone wider still from outcomes. We said these are the outcomes for residents. The wider impact on society upon the community will be this. Other examples of impacts be things like lower local hospital admission rates, increased volunteering rate, higher percentage of people who say they feel connected to their neighbours, for instance. So that wider community measure. A few people have said to me at some of the sessions, what's the difference between an impact and an outcome? Sue Holloway and I have put the questions in there. What is the change you want to see? What is you trying to achieve? To try and explain the difference. But to help you further, in the written guidance, I put down something that I heard someone say at the Birmingham event, which I thought was a really useful crystallisation of a difference. And that was that outcomes are easiest to think of as the things you will be measuring. So changes for your residents or clients or organisations. Whereas impacts are the things that other people will be measuring. So changes in headline statistics that local authority staff might measure, or central government agencies might look to, or the Office of National Statistics might report. So outcomes are the things that you can measure and you're aware of. Impacts are the wider changes that someone else will measure, record, report, for instance. Okay, so that's just talked us through the different stages of a logic model. We're going to now move on to consider how we might complete a logic model, and we're going to use the Poplar Neighbourhood Community Budget example. Some of you will have experience and knowledge of the Poplar Neighbourhood Community Budget, either from reviewing the information on my community rights page, or perhaps through discussions with Sarah Castro and the team at Poplar Harcar, one of the key partners. But for those of you who don't have experience of it, I'll just talk you through the local context that team were faced with and the response that they designed through their neighbourhood community budget. So Poplar Neighbourhood Community Budget is operating in 2 wards in East London, so Bromley by Bow and Mile End East. Both highly deprived wards in terms of household income, child poverty, people in work, for instance, and ethnically diverse areas, large Bangladeshi population, which the team identified would shape how they designed services and deliver them to the community in terms of how that community wanted to interact with the public sector in terms of language barriers, for instance. They looked and they did quite a lot of research through street surveys and also looking at national data and local data, and they identified that poor health was a real factor within those 2 wards. So Tower Hamlets had very high rates of diabetes, but within these 2 wards the rates were higher still, and linked to that other comorbidities around people's health, so healthy diets, people taking regular exercise, for instance, cardiovascular disease rates, and so on. They got some statistics from the local hospital trust around the number of people who are being diagnosed with diabetes within the 2 wards, and they also got data on hospital admission rates and how long people were staying in hospital for. So not just that people were going into hospital, but also that they were going in at a crisis point, and that was meaning that they were staying in hospital longer, costing the public sector more, and taking longer to get those people back into home settings, which research shows that people prefer to be treated at home, surrounded by their family and their community. So given those conditions, the Poplar team, which comprised the registered social landlord, which is Poplar Harcar, the local authority, the local GP groups, so clinical commissioning groups they're called, local training provider as well, DWP, so a wide range of partners came together and they said, well, our primary aim will be around improving people's health and especially helping people to manage diabetes. But through that contact, we'd also like to spread information about healthy living and health awareness, and we'd also like to move to what they called a social prescribing model. Social prescribing in simple terms is the idea that you should be able to go to your GP because people go to their GPs frequently and they trust them with the advice that they get from them. And the GP should be able to not just tell you this is what you need to do to improve your health, but they should be able to link them in to provide them with advice on the wider determinants of health. So things like improving your skills, managing debt issues, improving your housing situation. So the Poplar Neighbourhood Community Budget team said we will link up individuals, GP centres and volunteers, and the volunteers would then support individuals over the next year or so to improve their wider situation such that they were more able to manage their diabetes, be less likely to be admitted to hospital, and if they were admitted to hospital, be more likely to return to their home setting more quickly. So that was the model that the Poplar team developed. Don't worry if that's a bit high level and some of it's passed you by. Hopefully through filling in the logic chain model, you should get a clear understanding of what they're seeking to do. As I said, there's also more material about Poplar on the My Community Rights Our Place website. So that's some background to the Poplar project. We now need to fill in bits of our logic chain. When filling in a logic chain, it's interesting. It's often easier to fill in a logic chain in reverse order. So starting with intended impacts up here in the top right, then taking a step back and saying, well, if those are the impacts we want to achieve in our community, what outcomes do residents need to achieve to deliver those wider impacts? Okay, if those are the outcomes we want for our residents, what are the outputs and activities that will deliver those outcomes? So if it's around increasing resident skills, for instance, then our outputs are probably something around training courses. Then taking a step back and saying, what inputs do we have to pay for those activities? So what staff will we need? What budgets will we need? Will we need venues to run training courses, to keep the example going? Taking a step back further, what is it that is currently preventing our residents from getting into employment? Why are they not accessing the training courses that are available at the local college, for instance? Step back further, okay, the objectives that flow from our outcomes, and then finally, what are the local contextual conditions, what are the policy contexts around skills and training in this example? So by going backwards through a logic model, it's often easier to set out what you're trying to achieve. So you read a logic model counterclockwise, or this example counterclockwise, you fill it in a clockwise fashion. Today we're going to fill it in back to front, so I'm going to walk you through back to front what the completed Poplar logic model would look like. So starting us off then in intended impacts. So based on their research and their discussions with the community, the Poplar Neighbourhood Community Budget team said, right, what we are seeking to target first and foremost, what our most pressing problem as public service delivery is around ensuring that there are fewer hospital admissions for diabetes, and that where people are admitted, the length of time they stay in hospital is shortened. So our primary impact needs to be around fewer and shorter hospital admissions. Wider than that, we'd also like to see an impact on wider health metrics. So things around obesity, things around daily diet, things around daily exercise, for instance. So we'd like to see improvement in those health metrics that the local public health network, that the Department of Health would look at and report on a regular basis. They also have within their model activities around improving resident skills so they could get into jobs. So they said, right, some of our impacts will be around improving the skills profile and increasing the number of people who have GCSEs, A-levels, etc. within the community. And we'd also like to see increased employment rates, so a reduction in our local unemployment rate something that we're focused on. Finally, a wider impact that we could measure through resident surveys, for instance, or through borough-wide surveys would be around increased community satisfaction with public services in general. So more people feeling that they could influence services. So in high level then, and this is a summary of the Popular Neighbourhood Community Budget, I should say, just to illustrate the logic model concept, but there we have their intended impact up in the top right-hand corner. So to take a step back then, so what outcomes do individuals, residents, clients of the Popular Neighbourhood Community Budget model need to achieve to deliver those community-wide impacts? So firstly, if we want fewer and shorter hospital admissions for diabetes, then within the community we need individuals to be better at managing their diabetes. So our primary outcome is around better management of diabetes. So recognising how diabetes is best managed and kept under control, recognising when an individual's health might be worsening and getting help sooner rather than walking into A&E with a crisis moment in that individual's diabetes. So it's a better management of diabetes. Hopefully that will also mean reduced usage of the NHS more generally. So we talked about less use of A&E, more proactive use of cheaper primary healthcare, so GPs for instance, NHS Direct pharmacies for instance, to manage individuals' health, and increased awareness of health issues in general. So the sort of healthy living agenda, healthy diet, keeping active for instance. So people just being more aware of how what they do now can reduce their risk of diabetes, or if they have diabetes, how they can minimise the chances of having a crisis moment. Also, the team identified that if individuals are better at managing their own health, then they should see less need for other family members to care for those individuals. One of the things that their research had uncovered was there was lots of unpaid caring activity going on within the community as family members supported those with diabetes who were unable to or unaware of how they could manage their health themselves. So we should see less demand for carers within the community, and those carers could use their time for other community or wider economic activity. And then finally, in terms of outcomes, they'd expect to see more individuals gaining qualifications and more individuals entering employment. So if they're going to their GP and they're getting advice around, there's a training course on at the local centre which you might be eligible for and might interest you, they might go on that, get the qualification, get a sustained job as a result. There'd also hopefully be more volunteering, because volunteering is central to this scheme, so if they could promote the idea of volunteering amongst the community. There'd be more community engagement in general with health issues. So to summarise again then, those intended, sorry, I've just skipped a few, there we go. So those intended outcomes just listed there: better management of diabetes, those points here around reduced use of the NHS and so on, less need for carers within the wider community, and then those points at the bottom around the wider impacts of the social prescribing model. So I'm just going to break at this point and give you the opportunity to ask some questions. So there you should see the question break slide in front of you. So Jim, if I could hand back to you, have there been any questions put that need answering at this time?
Okay, I do have a question from Stephanie, which I can answer. The question is around timelines or deadlines of the 1st of September. Generally speaking, we have made this a mandatory requirement that all areas will have to complete a logic model, and we have put a deadline of the 1st of September to achieve that. We do appreciate it's only 5 or 6 weeks away, and it does sort of straddle a sort of holiday period during August. However, we did feel that if this is to be a meaningful exercise, then the sooner we can get areas to engage with this, and we can then feed back, you know, what we believe is proportionate CBA, then this would have to be done sooner rather than later. So that in a way, we thought the 1st of September was a realistic timeline to deliver sort of logic models, and also give the areas sufficient time to do that. It is 6 weeks. We appreciate, the general guidance is that, completion of a logic model should be done with as many partners as possible. And I appreciate over a holiday period there may be difficulty for areas in aligning diaries. However, if all partners aren't available on one particular afternoon, for example, as long as you can get a number of partners around the table, and then other partners can add comments at a later date during the 6-week period. So it isn't always necessary to have every partner around the table to complete the logic model. However, if you can get as many partners as possible to contribute to the logic model, then it'll be more robust for that. We will be looking at sort of on a case-by-case basis where areas are coming back to us either via you or directly to me about extensions to the 1st of September. It'll be on a case-by-case basis, and it will be exceptional rather than the rule that we'll allow any extension to deadlines. Obviously, as I mentioned, if partners aren't available, then it's a case of getting them to come on board at a later stage, showing them your first draft that you did when they weren't available potentially. If it's a small partnership, and I know to answer your question directly, Stephanie, if it involves a school, and I appreciate teachers are unwilling to do any work during that 6 weeks, if they can help it, then if they're a critical partner and it's a relatively small partnership, then I would consider that for an extension. However, if it was quite a wide partnership, then it may be that other partners could meet during August, and then the school could make a contribution or have a reread through of the logic chain in early September. I mean, the logic chain is in many ways it's a live document, and it can be reviewed and assessed beyond the 1st of September. So I hope that answers your question. Other questions, sorry, some are coming through now. If a range of different impacts, do you list each one separately, i.e. diabetes, skills, employment? I think this refers to, do you have to do more than one logic model if there's more than one theme, David? David, are you on mute?
I was on mute, Jim. Yep, still learning this process. Yep, so this was a question that came up in last week's session with the areas as well. And my response was, if the activities that an RPlace area is proposing are coherent, so if there's just one set of activities that they'll be delivering to one group of residents who have a specific range of problems, then keep everything, all those different outcomes in one logic model. So if you're taking a key worker approach, let's say, to support older people within the home, then that might lead to a range of outcomes for them around improved health, improved life satisfaction, feeling that they're engaged with neighbours, for instance. It might lead to certain skills development opportunities, whatever it is for that group. So that could all be listed in one logic model, because the logic is that by doing that one activity with those single set of inputs, you'll deliver a range of different outcomes. If an RPlace area is proposing two different sets of activities with two quite different groups of individuals, so they might be looking to support unemployed young people within their area, and then people from a certain ethnic minority within their area in different ways, using different resources and different partners, then I'd suggest that two logic models should be produced. Because if you tried to get that all in one logic model, it would be very hard for a casual reader to understand which of the activities listed in these boxes are intended to deliver which outcomes, for instance. So that's when going to that two logic model approach would make more sense.
Okay, thank you, David. A couple more questions. I think I can answer the first one from Kamal. Is how has the need to complete the draft logic model been communicated? Kamal, we did send out information to all of the areas about a couple of weeks ago, inviting them to the webinar. The way we've sold the idea is that, you know, we believe that if an area can actually find the time to sit down and produce a logic model, then if the panel can feed back to them about and classify them as, you know, level 1, 2 or 3, then potentially we are allaying an area's fears that the CBA process they're undertaking is appropriate and proportional. So, as I mentioned earlier, many areas have put in a lot of time and resource in their application to deliver CBA, and potentially they might need to, it may be too resource intensive. So we're hoping that through the investment of an afternoon early on in the process, we will be saving the area time and resource going forward, or indeed if it is confirmed that the project is complex and there are cost efficiencies, then at least we will be confirming that and giving them the green light that what they're proposing to do around CBA is appropriate, and they will need to buy in additional support, etc. Also, the completion of the logic model has wider benefits beyond CBA. It's also an opportunity for the areas early in the operational plan phase to focus in on what exactly the project is trying to achieve, what are the outcomes and what are the outputs. And the earlier they do that, then I believe the more focused they'll be and deliver a more robust operational plan. So in some respects, the logic chain is an opportunity really where they may be sitting on the fence about one or two issues or areas that they are considering potentially to be focused on. It sort of gets them off the fence in the early days and early weeks and gets them to sort of be as focused as they can about what they are trying to achieve going forward. So we do hope that process has a wider benefit to simply CBA. David, some of the outputs are really potentially quite long-term, i.e. getting employment. Are they expected to demonstrate these are achieved within the operational plan or RPlace program period? And that's from Diana.
Well, what I'd say to that, Jim, is that well, it depends obviously how long the RPlace program is intended to run for. If the outcomes are longer term than the funding being sought is for, then obviously they won't be around to track. The thing about a logic model is it's forecasting into the future, and it's saying, look, if our logic and our understanding of how this activity is going to take place is correct, these are the benefits downstream in future that we will see. Now, you can use a logic model to put in place monitoring and evaluation techniques, because it will tell you, you know, we're going to run 6 events, we're going to engage with 100 young people, for instance, and that can tell you or me as an external evaluator, right, I need to, you know, attend 5 of those events and have feedback sheets, or I need to plan how I'm going to survey 100 young people. You know, what methods, what questions should I ask? If, you know, the outcomes for those individuals are going to be beyond the timescale that the delivery team are around for, then I suppose you'd have to look at, you know, sustainability and, you know, what, who might be around later on to track those outcomes. It's not, a logic model isn't about locking you in to hanging around for years and years and years to track performance. It's about setting out what you think that future performance will look like. So, you know, I'd imagine lots of the outcomes that the RPlace programs are hoping to deliver, there'd be at least intermediate indications that they might be coming true. So in that example of employment, an intermediate step to getting someone into sustained employment probably be improving their basic skills and their accredited skills. So is there an intermediate step at 6 months, 9 months, 12 months that numbers of participants who have completed an ESOL course or have got an A-level, for instance? And then your logic model would set out, well, we're working on the principle that people with better skills find it easier to enter the labour market, so our outcomes around employment, we look like we should be on course to deliver those. So a bit of a long-winded answer there, but essentially they should be able to demonstrate some of their intermediate and some of their longer-term outcomes. But yeah, there may be some in there that they won't be around to track. But so long as the logic underpinning their model is there, then it's fair to include them in the model.
Okay, thank you, David. That's the end of this round of questions. So
okay, I'll move us on then to the next slide, Jim. So if you remember then, we completed the two right-hand boxes for the Poplar Neighbourhood Community Budget logic model, and we now need to run through the nuts and bolts of what they've been doing on a daily basis, if you like, within Tower Hamlets. So in terms of outputs, this is quite straightforward. So those of you who've been on some of the cost-benefit analysis training might remember. The Poplar team set themselves a number of targets. They said that we want to deliver 2,000 care packages, so 2,000 individuals entering this social prescribing model and being given a package of support, not just to manage their own diabetes and their general health, but also to access wider services that might improve their personal finances or their housing situation or their skills, for instance. So 2,000 care packages was one output. There was also an output around training courses. So they said we'd like 300 of the individuals we engage with to go on a training course as a result of the advice they're given. So not everybody who gets a care package will need to improve their skills or be ready to enter employment, but a number will. And they also set themselves a target of recruiting 50 volunteers to support those individuals on the care packages. So high level, the outputs that they were aiming for and which they could measure their progress against on a month-by-month basis, for instance, are just set out there in that outputs box. In terms of the activities then to deliver those outputs, again, pretty straightforward. Obviously, there were the activities of the GPs and the volunteers in terms of developing those care packages. So sitting down with those 2,000 individuals and working out their health needs and their wider needs, and then designing a program of support around that. There was activity around supporting the volunteers. So lots of those 50 volunteers were new to the idea of volunteering, supporting someone, advising them about their health and their well-being. So the team identified that they need to employ somebody to support the volunteers on a daily basis if they came across issues or had concerns about the individuals they were supporting. There were training courses that needed to be run. We talked about 300 people accessing a training course, so they needed to get the college to run training courses. They need to publicise the work of the neighbourhood community budget, get people to engage, to understand what the community budget was aiming to achieve. So the day-to-day activities of the partnership set out there in that middle chevron. Taking a step back further again then, so what are the inputs that the Poplar Neighbourhood Community Budget team brought to bear to deliver those activities? Those of you who've met Sarah from Poplar Harcourt will know that she and her team, very enthusiastic. They were fortunate that they had 2 or 3 members of staff to dedicate to this program full time. There was also inputs from the local GP, clinical commissioning groups. So they were putting in an extra half an hour, an extra hour with patients with diabetes or at risk of diabetes, so over and above what they'd usually spend with someone at a typical GP appointment. There was the time that volunteers were offering. So those 50 volunteers were spending a total of 9 hours over the course of several months with individuals, and that time was being given free of charge. They were getting their expenses reimbursed, but beyond that, they were giving their time free of charge, so that needed to be listed as an input. There were various grants that the Poplar Neighbourhood Community Budget team received, both from central government and also from their local job centre through DWP trading monies, for instance. And there was also the use of the Burdett Centre, which is the local community centre, on one of the Poplar Harcar housing estates. So they were given the use of that to host training courses, to run community events and publicise the work of the neighbourhood community budget. So that was an input they needed to consider. So there you should see in front of you now those inputs are listed. In terms of the rationale for why the Poplar neighbourhood community budget was needed, so why couldn't we just continue as things were and hope that the NHS and the wider community could deal with the issue of high diabetes within Mile End East and Bromley by Bow? Well, the team thought about this and reflected on the research they'd done on the street and with stakeholders who had knowledge of health issues and local community needs. And they firstly identified that, look, we've got a very high prevalence of diabetes within these areas, and it's getting worse, and it's getting worse more quickly than in other parts of Tower Hamlets, other parts of London. So that suggests prima facie that the current way of dealing with things is not working. Secondly, they looked at research that said that there are multiple causes of ill health. So it's not just the fact that someone might have a poor diet or have limited exercise or be genetically predisposed to diabetes. It may also be that they have poor quality housing, that they have poor mental health, that they're depressed, for instance. It may be that they're not in a job or they lack the skills to get into a job, because evidence suggests that if you are economically active and socially active, you have generally better levels of health, you put lower levels of demand on the NHS. So they thought, well, there are multiple causes of poor health, and at present the way those multiple causes are addressed is very disparate. So you get advice on your skills from Job Centre Plus, for instance, or an intermediate labour market provider. You get advice on your health from your GP. You might get some support from adult social services if you're a bit isolated or an older person, for instance. And that's all really disparate, and people need a way of accessing that in one easy-to-access way. And finally, in terms of rationale, the point was made that if we could have a one-to-one volunteer resident approach, then it's more tailored. So that volunteer can understand exactly what it is about that person's life and spend some time with them understanding that and help them to improve their health and their wider well-being. A professional who only has 20, 25 minutes with that individual once every year or however long it is never going to be able to get to that level of detail. So they're only going to be able to advise generic support, as it were, and they might advise support in the wrong sequence. So somebody might really need support around their housing issues before their health will improve. But how do we sequence that if housing and health issues are delivered by separate agencies, using separate forms at separate times? So by having a bespoke approach, which is probably what some of your R-Place areas are thinking about, having a sort of lead professional model, as it's sometimes called, we can have a more tailored support, and that support is more likely to be effective. People are less likely to be advised to do the wrong things, or they're less likely to drop out because they feel that support is just generic and not relevant to them. So rationale there in the box, those 3 points that I've just mentioned. And then just finally in this box, okay, what were the programme objectives of Poplar Neighbourhood Community Budget? So these were set out in their initial plan. No doubt the R-Place areas that you're supporting are getting to that point where, as a partnership, they've got some high-level objectives. They've come together and they said these are the 4 or 5 key things that we are here to do to undertake. Within Poplar, the objectives at the highest level were delivering care packages with community support, so developing that idea of social prescribing and care packages. It was around, in terms of process, developing more cost-effective ways of managing health. So if you think about it, that's quite a high-level statement. We're going to deliver more cost-effective ways of health. It's only when you get to the outputs, the outcomes, that you put the flesh around that and say, what do we mean by a more cost-effective approach? And then a final objective for them that I've just listed here today is around developing a replicable model. So this programme is only operating in 2 wards of Tower Hamlets, and from the outset they were thinking, if we're successful with this social prescribing model and how to manage diabetes, how quickly can we roll that out to other parts of Tower Hamlets, to other parts of London? So those were some of the objectives. I'll just skip through. Yep, you should see them listed there in front of you. Right, I realise I've gone through quite a lot of detail there about Poplar in a short space of time. So again, we're just going to have a quick break for any further questions. Jim, have there been any more questions since the last break?
No. To answer your question, David. No, there haven't. I don't know if anyone has an immediate question they just want to type over, and I will pass it on to David. I mean, obviously, we don't want to be asking questions for the sake of it, and I appreciate people's time is precious. But if anyone does have a question, one's coming through. Can all the question and answers from the sessions be published on the website or sent to RMs for reference, please? Yes, I've made some notes. Sorry, Sue, I'm trying to think that if they are all written in response to the questions, it's me who's going to be writing it. So yeah, I will look to make a summary of the questions that have been asked, and we will put them out in a sort of frequently asked questions document. This will happen during the course of next week, if that's okay.
Okay, if there are no further questions, Jim, then I will crack on with the final part of completing the Poplar example.
Okay.
So we're into this final box around conditions, and here people remember we need to think about what are the statistics, the evidence that proves the need for Poplar Neighbourhood Community Budget, what are the key pieces of policy around health, skills, for instance, that shape their approach, because obviously they don't want to be designing something that runs completely contrary to what is going on within the wider health service, and what needs to be in place for change to occur. So what are those wider, sometimes called normative changes or behavioural changes within the community, within public service professionals that need to take place for this new model to be a success. So in terms of the local context, the team gathered together a lot of data, both secondary data, so looking at things like joint strategic needs assessments, Department of Health publications. There's a lot of data out there about local areas and the issues they face. And they identified high rates of poor health within the two wards. They identified the detail around deprivation and what's driving that deprivation. So is it poor quality housing? Is it low family incomes? Is it high numbers of children in need or potentially going into care, for instance? They identified stuff around the demographics of the area. So we talked around the issues of a large Bangladeshi community, the age profile of communities as well. So are elderly people in a position where they can be supported by wider family networks? What challenges do younger people face in that community, for instance? So they identified those contextual factors, and they put them benchmarked against other parts of Tower Hamlets, against other parts of London and the UK national averages, for instance. They looked at the policy context and they said, well, firstly, there's massive budget pressures within public services, including within healthcare. So hospitals can no longer afford to keep people in with conditions like diabetes. It's more cost effective to return those people to home settings sooner. So that's a key driver to increase care within the community, if you like. There was obviously the change to clinical commissioning groups. So GPs now have far greater budgetary controls over how healthcare is delivered in their local area. So can we get GPs commissioning this kind of social prescribing role, with them recognising the added benefits it brings them in terms of fewer people turning up on a Monday morning or seeking an out-of-hours emergency appointment because they're better managing their care. And then there was the wider health and well-being agenda as well that was being operated in Tower Hamlets, and a policy called Well London, which is sort of a wider London, pan-London health and well-being approach. And that was focusing on what are those wider determinants of health, how can people be helped to manage their own health and take responsibility for healthy living, better diets, for instance. So those were some of the key policy contexts they identified, and they said, well, what we're proposing chimes with those channels, those directions of travel. So we should get wider support for what we're proposing. And finally, they said, well, what needs to be in place for change to occur within these two wards? and they said, well, firstly, it's about changing attitudes towards health. So it's no longer a case of if I get ill, I go to the NHS or the GP, or I walk into A&E at any time of the day and expect them to solve it for me. It's about me taking proactive responsibility for my health. But it also is about giving people and communities the resources to do this. So it's no point telling people, live more healthily if they don't then have the advice around what you mean by healthy living, and have that advice in a format they can access and understand. So is it around language barriers? Is it around cultural barriers of how you receive advice and support from wider networks, for instance? So those were the behavioural changes that the pilots knew that they had to help deliver. So just to summarise those in the top box there, the conditions, the policy context, and what needs to be in place for change to occur. So that therefore is a completed version of the Popular Neighbourhood Community Budget. As I say, it's a simplified logic model, but hopefully it will give you a flavour of what they're doing. I would recommend that you look at some of the presentations and further detail about their model that are included on the My Community Rights website. And also, for those of you attending the various CBA more detailed sessions, there are 2 more in September, we'll be running through this example in a lot more detail with detail on the costs, the numbers of activities we undertook and stuff like that. So that is a completed logic model, and hopefully that's given you confidence that completing a logic model is not too difficult. Getting these ideas down on paper is not too lengthy a process. And secondly, that it can be done in partnership. You don't need really detailed understanding. Perhaps the only one where you do need detail is around that local context of statistics and numbers, for instance. Okay then, so the next slide just sets out some thoughts on how do you get to a good quality logic model. So really this slide is aiming to give you some tips and tricks to pass on to the areas that you'll be supporting. So when they turn around to you and say, oh, this logic model, we're still a bit scared about it, this should give you the chance to say, think about it in these ways. So firstly, and I should say this is Sue Holloway's thoughts from Pro Bono as much as mine, it's about setting out the pathway. What we mean by that is involve as many stakeholders as possible when developing the logic model. So get as many of the agencies involved in the partnership round the table. If you can't get them around the table because it's summer holidays, as been mentioned several times, share the logic model in its various iterations by email. Get people to comment on what they understand the outcomes and intended impacts of this project to be. The importance of doing that is that because people often come from a background, I'm a health worker, or I'm a college person, or I'm a community development officer, I think the outcomes of this project are the outcomes that I strive to deliver on a daily basis. It's about diabetes, or no, actually, Popular is about improving skills and employment. And it's only by getting everybody to contribute their views that you can build up that rounded picture of, actually, yeah, this is what our program's about. It isn't just about my agency's targets, it's about all of our targets. So involving as many stakeholders as possible over the next 6 weeks should get to a common understanding of the project. And hopefully it should also start to flag up some of those sort of unexpected outcomes of, actually, yeah, our program could be around that, and it could be about that. And just by sharing ideas, we've advanced our understanding and our ambitions. In a good logic model, there should also be as many numbers as possible. So in terms of outputs, for instance, it should be possible to list, the number of events, the number of training courses, the number of residents who might benefit from a particular activity. Trying to get those numbers in there now will help an area to work out their costs. So if they know that they're going to be putting 50 people for a training course, it's quite simple then to work out, well, what's the cost of an average training course, and then multiply that by 50. If they know that they're going to be running 20 community events over the next few years, you should be able to work out quite quickly, what's the cost of running that event in terms of hosting, marketing it, staffing it, for instance. So by having as many numbers in as possible, firstly, areas should be able to work out their costs. Secondly, they should be able to start thinking, well, what happens if those numbers go up or down? What if we don't hit those targets and deliver that number of activities or outputs? What if that number of people don't achieve those outcomes, whether it's sustained employment and so on? What is our plan B? Have we got an alternative? Can we divert some of our activity towards part of the proposal, or would we be a bit stuck and we'd miss our overall targets? So setting out a pathway, really important in a logic model. Once the logic model has been sort of drafted and it's perhaps gone around the partnership a few times, or it's been discussed over an afternoon on a big table, then you need to check to see if it's plausible. So as a relationship manager, obviously you are a fresh pair of eyes coming to this, but also encourage the partnership to test it with wider partners. So, are there other people within the local authority, within the local health system, or within the local voluntary sector who you could put the logic model in front of and say, is this logic correct? Do you think that there is actually an issue here that needs to be challenged, or have we just become fixated by this issue and not realised that there are other activities out there that will solve it, or the issue will go away of its own accord? Is it clear that the activities that we're proposing will lead to these outcomes, or is it a real jump, and our activities need to be far more focused or far more specific? So check it with a wider audience if you can to see if it's plausible. Get the partnerships to think, is this doable? We've set out here lots of numbers around numbers of activities, events we're going to deliver, and we've got some idea of the resources we've got in terms of staff and budget. Do those two match up? Do we have enough staff working enough hours in the day to deliver these activities? Or do we need to rethink and scale back our ambitions, or call in more resources? Beg, borrow, steal them, whatever we have to do. So is it doable? There was a question early on about testing, monitoring, evaluating the logic model. So look at the types of outcomes and impacts that the logic says that our place program is going to be delivering, and saying, okay, can we measure those impacts? So is that data reported regularly, and is it reported at the spatial level we're operating in? So if our place program is just working on a few streets, and we're going to try and reduce the unemployment rate on those few streets, well, unemployment figures aren't reported at street level, so we can't demonstrate that impact. So we might need to think again about our impacts. Alternatively, you might look at it and say, actually, this is about ill health within this ward, and yes, health statistics are reported at a ward level on a regular basis. So we can test, we can measure our performance. Another example, if we're going to be working with hundreds of residents, how can we test whether we've engaged with those residents? We're going to need to do large-scale surveying, perhaps. So have we got the skills in-house, or can we commission some kind of survey work? So start getting the partnerships to think about how they're going to monitor and evaluate. So they don't get to the end of their delivery and then say, right, we've just got to reflect on what we've done. Oh, we haven't collected any data. And finally, that point about meaningfulness, so that links back to the plausibility of the logic model to a degree. Look at those outcomes and say, really, is it worth the investment that we're proposing? Is this such an issue within the local area? Does the local context stats show that we've really got an issue in this locality that needs challenging, or will the issue go away of its own accord in due course? So 2 steps there. When setting out and developing a logic model, involve as many people as possible, include as many numbers as possible, tweak those numbers up and down to develop scenarios. And then once you've done that work and you've got a good draft of a logic model from your teams, force them, or challenge them, I should say, around its plausibility, around whether they really can do it and can they test and demonstrate what they've done. So if you go through those 2 extra steps, they should have a good logic model in front of them. Just finally from me, before we go on to a last poll and opportunities for questions, final questions, some of you will be supporting areas which are asked to do a detailed cost-benefit analysis. And that will probably scare them because I know from feedback from areas and from relationship managers that they're not very experienced with cost-benefit analysis, or they've only had fleeting experience. By completing a good logic model, it should make undertaking cost-benefit analysis so much easier. And the way it does that is the logic model provides data and evidence that sits on either side of a cost-benefit equation. So this diagram here in front of you on the screen shows a typical cost-benefit analysis approach. So it's saying, do the benefits on the right-hand side outweigh the costs of delivering this program? And hopefully they do, because if we're getting more value in benefits than we're spending in costs, then we should be doing more of this. If it's costing us more to deliver this than we're getting back in the value of benefits, then we should stop doing this. So if you've got a good logic model set out on a big piece of paper, you should be able to pick from it bits from it and drop it into a cost-benefit analysis tool. So in terms of costs, you should be able to take the stuff that you've written down in the inputs, activities, and outputs box and put that on the cost side of a CBA. So the inputs, for example, you might have listed here bold costs that agencies are going to put in. So the local council are going to put in £25,000, for instance. That is a simple costed input that you could drop straight into a cost-benefit analysis spreadsheet. Alternatively, there might be stuff in the inputs box around, 2 members of staff full-time to support this. A very simple step would be to then say, okay, what's an average wage within that organisation? Okay, 2 members of staff is equivalent to £60,000 per annum of cost input. So again, very easy to work that out. With activities, with outputs, if you've got listed numbers of, 5 events or 100 training courses purchased, again, quite easy using databases that are out there or just having quick discussions with people to understand what is the unit cost of each of those outputs. Okay, let's just multiply them up by the numbers we've got in our logic model, and you should quickly be able to build up a picture of this program is going to cost us not just for the grant that we're going to get from DCLG through locality, but also the cost of that staffing input, the cost of the equipment that is going to be dedicated to this program. And you should be able to build up a picture of your costs quite easily. On the benefits side, it's slightly more complex, but not too complex. If you've got completed impacts and outcomes boxes, these should list changes that you expect to see within residents of a community's lives and within the wider community as well, so changes in unemployment rates, for instance, youth unemployment or increased skill levels. There are various tools and toolkits out there, some of them developed by New Economy, others things like social return investment tools that some of you might have come across, which help individuals and partnerships to turn those types of outcomes into monetary values. So we can help areas work out, well, if we get 50 people off job seekers allowance and sustained job, we can tell areas how much that is worth to the taxpayer or worth to the economy. It's quite a simple step to take, and the training in September will walk areas and walk relationship managers through that translation process. So if those boxes, the impacts and outcomes boxes, are full of the benefits that hopefully will be delivered, it won't be too difficult to turn those into pounds and pence figures, which can be then weighed against the pounds and pence figures that you've got on your cost side, and then you can work out if your benefits value outweighs the value of your costs. So that's just a brief run through. As I say, there'll be more sessions in September. No doubt there'll be more written guidance as well, just helping areas around cost-benefit analysis. Just finally then, we're just getting to one final poll. Jim's going to be launching this on your screen in a minute. This is just to let us understand whether you now feel ready to support areas to complete their logic model. So when we started this session, about half of you had limited or no experience of logic models, and obviously areas are going to be working over the next 6 weeks to develop a logic model. So the question we're putting to you with this poll is, do you now feel ready to support areas to complete their logic model? So this should just be launching on your screen any second now. Should be a blue screen coming up. Let me see. It's taking a little bit of time. Jim, is this something
Yeah,
at your end?
you may, I saw it flash up, you may possibly have a slide over it. The slide you're currently on, can you move that? Or?
No, it should launch
okay.
as a blue screen. Oh, sorry, it's saying closed now. No, I don't know why that's closed. So sorry, people, we seem to have closed the poll before it even opened, so you're not able to vote. Hopefully, poll results, so and 0, none of you got the chance to vote. Hopefully what I've talked you through for the last hour or so has given you that confidence. What I'd suggest is those of you who still have some worries, concerns about supporting certain areas of the logic models, either use the question session that we're just going to come to now to raise those, or obviously you can get in contact directly with Jim, and Jim can flag that and link you to the further support that's available through written guidance. But hopefully, as I say, when we put this question to the areas, obviously in a slightly different wording, nearly all of them came away saying, yes, I'm confident to start this, might need a bit of help from my relationship manager, but very few of them, were there any, Jim? I can't remember, we'll have to go back, but I can't remember any of them saying, I'm still really scared by this. I think it had given them confidence.
Yeah, no, the feedback was good. We had, I think it was over 90% said they felt confident to complete it independently or with a sort of minimum of help.
Okay,
so.
That's good to hear. Just final few slides. The slide up here just sets out the timetable for the work on the logic models and flowing on from that into submitting operational plans. Jim, if I hand over to you and you can just talk the audience through this slide.
Sorry, have you got the slide on screen, David? We can just use your presentation.
It is on screen, yeah, but it doesn't seem to have flowed through to the audience view. Just on the polls, I'm just going to close. Yeah, if I click hide. Have you got it now?
Yes.
Yeah, there we go.
Thank you.
Cool.
Okay, we touched on this briefly in the introduction. As I mentioned, we held a webinar last week. We have another one on Friday. Attendance has been good last week, and we've got over 40 delegates tomorrow, which is excellent. And the feedback from last week's panel webinar has been favourable. The 1st of September deadline doesn't appear too much concern to the areas. So hopefully, that is realistic. As I mentioned, we've got a panel together of David, including David, representatives from Pro Bono Economics and also from the DCLG, and we'll be looking through all logic models the end of the first week in September, and we'll be getting back to areas by the middle of September. To give them some steer and guidance on the level of CBA that is required. In addition to that, we have the CBA events on the 25th and the 30th of September, I believe, are the provisional dates, and these will follow on from those first round of CBA events that were held in York and Bristol and Birmingham in June and July. Obviously, there's the relationship management support from yourselves, and in addition to that, there is the consultancy support of up to 5 days. And one of your roles as relationship managers is in that first meeting you have with your area is trying to get a feel for what consultancy support they require going forward. They obviously supplied that information to us in their application, and they made recommendations of where they'd like the direct support. That was also discussed at panel, and that information will be relayed to you as relationship managers to support that first session that you have with the areas. And then they have to submit their draft operational plans by the 21st of November. And then a peer review process will start on the 25th, running through to the middle of January. I believe it's the 12th of January. And there'll be 2 peer review events where areas will reflect and review other areas' operational plans. And then there'll be the submission of the final operational plan in February 2015, and sign off in March 31st next year. So hopefully that will give you a feel for the level of support that areas will be getting and the timeline with respect to CBA and where the logic model fits into that.
Okay, thank you, Jim. So all that leaves then in terms of the slides is the final slide for questions. Have there been any more questions posed in that final section of the webinar?
Okay, just having a look at a couple of questions. What's the difference, so this is from Lorna, what's the difference between SROI and CBA?
So the difference really is one of the level of rigor, I'd suggest. Social return on investments, the two are related though, I should say. The social return on investment approach takes a principle that a public program will deliver lots of social benefits, so improved well-being for people, improved health, people feeling more integrated within their communities, for instance. And the social return investment models that have been developed by people like the New Economics Foundation and so on quite simply take a calculation of saying, well, how many individuals have been helped to get those outcomes? Let's say it's in improved health, for instance. And it says often, well, what would be a proxy measure for the value of that? So let's say that the amount that people spend on gym membership is a proxy for how much people value being in good health. So we'll say that good physical health for 100 people is worth the equivalent of 100 times local gym membership. On mental health, the example often is how much would a typical counselling cost for someone with mild or severe depression, for instance. That's the value of good mental well-being to individuals. So it's a simple calculation of individuals times unit cost. The CBA approach that we've developed here in Greater Manchester is a bit more rigorous, I'd suggest, in that firstly it looks in more detail about exactly how much those outcomes cost individual public agencies. So not how much people would be willing to spend in the market, if you like, to solve those problems, but how much the NHS might spend on a counselling course, or how much the NHS spends to solve some, if someone's having regular appointments because of poor health or being overweight or something like that. There are also various intermediate stages that our model takes, such as understanding that the outcomes that are delivered for those individuals might not be solely due to the intervention. So they might have wider support, peer support. They might be accessing other public services as well, which mean that they improve their health. The CBA model we use also looks at something called dead weight, which is saying, well, some people would have got healthier anyway without public intervention. That's something that social return investment models often don't consider. So in summary, Jim, it's a more detailed, rigorous approach from social return investment. I think once we've reviewed the logic models at the start of September, those areas that do need to do light touch CBA, the types of approach they'll be taking will probably be those sort of SORI type approaches, saying, ballpark will be working with 100 people, they'll be getting these kind of outcomes, a rough value of those outcomes is thus. For the more detailed ones, we're going through those extra steps I've just described. Okay. Any more questions?
Thank you, David. Yes, there are a couple more questions. One from Chris. My experience is that logic frameworks can be greatly affected by assumptions. Can you say a little more about how they are identified and designed in?
I'm just looking at that question on my screen. I'm not sure I fully understand it. I mean, obviously a logic framework, when you set it out, has a lot of assumptions, that if we deliver this activity, it will result in this number of outputs, and it will have this outcome on the people who attend that activity, let's say, or take part in that activity. Obviously, because you're doing this ex ante or before the start of the program, it has to be based on assumptions. Though, well, I suppose you could say, this type of activity has been delivered elsewhere and it's been proven to deliver these kind of outcomes and these impacts. So you might do some wider research onto why the R-Place area is proposing something. I agree with Chris's point around it. It links in with that idea of a plan B. So if you think about the assumptions in your logic model sit between, hang on a minute, I'll just scroll back to the relevant slide to talk people through it. So back a bit more. There we go. So the assumptions, if you like, sit at the connections between the boxes. So there's an assumption that takes you from these outputs will lead to these activities, which is around the management of those inputs, how they're going to be profiled and used correctly. There's an assumption that these outputs will lead to these outcomes. Now, the logic model helps you to identify those assumptions, and it also helps you design monitoring systems for testing those assumptions. So, in example here, I'm making the assumption that care packages should result in people being better able to manage their own care, which will lead to less need for carers. So that's making the a priori assumption that those individuals firstly were calling on the support of wider carers. So I'd want to test that in an evaluation. I'd also want to test this less need for part of that. So I'd want to ask myself, well, how many hours previously were carers supporting that? How many are they doing that now? Is that change delivered by the care package? Or is it because the carer lives further away, or the carer has a full-time work commitment, which means they can't care, for instance? So Chris's comment is right. There are assumptions in this. I suppose this is showing how you can test those assumptions. And as he said in his point, thinking about plan Bs. So if we find that there isn't less need for carers, and there's actually greater need for carers because volunteers are identifying bigger problems within that individual's life and the carers getting dragged into it, well, how might we respond to that? Do we need to then bring in another statutory partner who might deliver something, for instance? So I hope that's started to answer. I'll click back through to final questions. I hope that's started to answer the question. But if not, perhaps we could take it up offline as well. Any further questions?
Okay, I think there's just one more. It's Alana was asking about assuming that volunteer hours should have a notional cost attached for inputs, is there a recommended rate per hour that would be acceptable to use? I don't know the answer to that off the top of my head.
There are various approaches to costing volunteer hours or in-kind contribution, as it's sometimes known. Some people just use the minimum wage. In GM and the Volunteering England website, or the National Volunteering Association, sorry, I don't know the exact trade body name, but they have guidance on this as well. The approach we often take is to identify the median weekly or hourly wage, whatever unit is that you're multiplying by. We take that approach because we feel that volunteers often have more skills perhaps than someone taking a minimum wage job would have. They're delivering more value to a project because often they're coming from quite an experienced professional background or wider social background. So the approach we often use is, what is the median hourly weekly wage? Okay, we're getting 6 weeks of volunteer input times that by the median weekly wage. So I'd recommend that approach over minimum wage, but you do also see minimum wage used sometimes as well to cost up volunteer hours.
Okay, thank you, David. One final question before we close is Lorna was asking, what is the consultancy support offer? The consultancy support offer, Lorna, is well, it's up to 5 days per area, and it's the option for areas to sort of buy in expert advice on a particular issue. So obviously we've had a discussion today on CBA. So if an area identified, and if the logic model identifies that an area does need additional support on CBA because of the complexity, then we would look to identify a person who had that necessary skills and experience to go in and support the area with CBA. there may be other areas of expertise that are required, maybe about leadership and governance, or maybe legal questions about developing a partnership or implementing a service. So it's that expert advice, and they get up to 5 days between now and the submission of the operational plan. Okay, I think that's the last question, and hopefully we've answered them all to your satisfaction. After this session, by all means, if you want to email me how you thought today's session went and give any feedback, then please do. Just give me a call or email me. I'm in the office for not this afternoon, but for the rest of the week, because it would be interesting to get your feedback. Apologies about the final poll. I'm not quite sure why that disappeared as quickly as it did. But hopefully you have found the session useful, and you do feel now that your knowledge on the logic model has increased over the last hour and a half, and that you do feel with the guidance that's also available, you do feel that you're in a position to ask any or to answer any questions that the areas may throw at you around the logic chain, not only about the concept and actually completion of the model, but also about the process and why we've included it in the program, etc. I say, if you want any discussion offline, then please give me a call or email me. So all I need to do now, David, is just to thank you really for your time.
You're welcome. Hope everyone got something out of the session.
Okay, well, thank you everyone, and I'm now going to put an end to the session. So have a good day, and we'll catch up soon. Thank you. Bye.